Revealing your migraine in the workplace is a very personal decision, and it comes with both challenges and surprisingly benefits. The challenges are kind of obvious. First of all, you're giving up your health privacy, and a lot of people are not ready to do that. A second, you might be denied opportunities because you have migraine. I know it happened to me, and in retrospect, I'm okay with that. But when you're eagerly working for something, it's really hard to pass those things up and to think, did they pass me over because of migraine? Or was it something that I did? And sometimes you never really know.
Right.
And you might be called oversensitive or a hypochondriac. I think most of the people who I have met who have migraine are not wimps or fakers. In fact, they're very courageous warriors. And to be called that is just so hard. It's just
Yes.
so hard to hear. But if you do share that you have migraine in the workplace, number one, it's easier to ask for accommodations. Second, managers and coworkers may be more supportive and understanding. And I learned this in spades from many of the people I interviewed in a variety of different kinds of jobs. And the stories that they told me were touching. Employers can reduce the triggers in the workplace and may invest if you come forward and then others come forward. I mean, just think about the Me Too movement. And once one person came forward, others felt courageous enough to come forward. And so when an employer sees that, then it's very clear they need to do something about it. Honesty and transparency can actually enhance your job security, and you're able to be your authentic self. When you have to pose or lie or not talk about something, there's a level of stress that creates unto itself. By, going in and throwing up in the bathroom and then coming back and pretending like nothing just happened, that that creates stress over time. It's ironic, but so sharing actually relieves you of that stress.
And it's something I feel like it's a something you learn over time. Even as your migraines adapt and change over time. So my migraine pattern completely changed after residency when I was having multiple pregnancies and working full time. And so what I initially told my employer about my migraines really changed because the pattern increased in frequency and intensity during those critical sort of 5-6 years. And it was very important to work closely with my colleagues to come up with a plan, because for me with the visual problems, I could be in clinic seeing a patient, nothing life threatening, but of course, it's highly annoying for the patient if suddenly their doctor calls in sick and, can't, finish seeing the patients for the day. And then another doctor's working in those patients. So they had, 20 patients to see, and now they've got 25. So it was definitely, I mean, it's tough. There's no two ways about it. And you can prepare just so much, but it does really help. To have those kind of conversations. So when is the right time to initiate a conversation with your employer?
Yeah, so you want to look at a few key flags going on in your life. First of all, if migraine is affecting your performance at work, not just, oh, I feel badly and I'm having a sluggish day, but really, let's say you make a mistake in your job and you know it's because of cognitive challenges or memory issues that you were having during an attack, or maybe like the police officer, you were putting someone's safety at risk, your own or someone else's. If you think that reasonable accommodations could make a big difference, like if you just had better lighting at work or a more flexible schedule, then you could perform well. Well, it's time to do that, right? And I got bold enough and severe enough where that's exactly why I came forward. You want to see the work culture become more supportive and help others who may be struggling.
How do you initiate a conversation with your employer? And I'm really curious about who you speak to. I have been fortunate in my work environment where the person I directly report to and the people that report directly to me, I've been able to have that sort of free conversation. But I know not everybody is in such a strong situation.
Right. So you've got to have a good plan to start with. And the first part of the plan is understanding your audience, and just realize that most bosses, the stats are 4 out of 5 bosses thinks migraine is not a reasonable rationale for calling in sick to work. Okay, very misunderstood. So assume your boss knows nothing. Or maybe your boss has somebody in their family who has migraine and they have it in a very different form or severity than you have it. So you're going to have to do a little bit of education first about migraine's a spectrum disorder. It has, as many as 40 different symptoms. It's not just a headache. And for me, if I get exposed to too many triggers, it can begin an attack that can land me in the emergency room and cost the company money. So that might have to be in your very, first educational conversation, right? So what do you know what you're going to share with your boss about how it affects you? And I usually coach people to say, talk about the impact, the financial and physical and emotional impact that it has upon you and your ability to work, although less on that, I would say. Second, you want to know your goals. Are you simply explaining how you cope with migraine disease, or are you asking for accommodations? So when you go into the meeting, do you just want to be understood, or are you asking for something? And depending upon the receptivity of them, you may ask for a little bit more, because most accommodations, as we're going to see, cost the employer almost nothing. And it's an opportunity for education of the other team members. And then third, bring documentation. So a lot of people are frustrated because migraine doesn't have symptoms that are easily recognized. If I had an epileptic seizure, you would understand that I had epilepsy, right? But I'm having a neurological event going on, and a lot of people can't see that, and so they don't understand it. What they do understand is 3 months worth of data that you collected on your phone, or a diagnosis from your doctor, which shows exactly how many days it's affected you and the severity of it and the symptoms that you had and the implications. I had to go to the emergency room this time. I had to go to the doctor. I had to take 2 days off of work. Those are real things. And so data usually speaks volumes and cannot be refuted. So those are the things that that can be powerful in a conversation with your employer.
I think there is a lot of creativity that can be kind of harnessed to make sure deadlines are met and work gets done, definitely. And I think as a employer, setting up those kinds of expectations that there are solutions to this that don't involve suffering and working through is great. I mean, it's a model for everyone. So tell me, this really puts us at our next slide, what employers can do to create healthier workplaces. What do you recommend to other employers?
Yeah, there are a number of things that can be done. For me, a flexible schedule was a huge blessing and made a big difference in my condition at the time. The opportunity to take breaks when you need them in some sort of factory kinds of situations, or teaching, or healthcare. This is really important, because you don't time your migraine attacks to 10:15 in the morning, right? If you can
Right.
take that break at 9:30 because you're having a tough time and you need a dark, quiet room, which is one of the other things, a quiet room, in order to do that, that could be a big difference maker. And these quiet rooms, because so many people are dealing with a variety of disorders that are better suited by having a dark, quiet space, you don't even have to say, I have migraine in order to request a quiet room. Half the people you work with will be like, yes, thank you very much.
Yes, that's true.
Yeah. The opportunity to work from home. I believe the number of remote jobs has gone up 10x since the pandemic. And so that is one, if you haven't tried it before, can be big. Alternate lighting. I know people who don't have migraine but are light sensitive who have requested this. It's not that hard, particularly if it's an isolated space. If you're getting in a big factory space or a big hospital, much harder, right? Screen filters and other computer hardware or software. There's something, and we can talk more about this in a minute, but there are a number of different ways to adjust the lighting on your screen Noise management, like noise canceling headphones. A fragrance-free workplace is going to be a political challenge because some people really love their fragrances. They love their, uh, office scent or
Right,
whatever.
right, yeah.
Air purifier. It's hard, but there are some places that will do that. So that might be the most challenging of all of these, actually, is to get a fragrance-free workplace.
I mean, when I was starting my career, I wouldn't have even known to ask for a lot of this, or that it was in my rights to do that.
But first of all, you are not required to disclose that you have migraine to your employer. You can say you have a medical condition that requires that would be improved if you adjusted the lights, for example, or had a quiet room. That's all you have to say. To be eligible for the legal protections that are provided by the Americans with Disabilities Act. And I don't know if there's something similar in the UK. I know we have people from all over the world listening to this, but check into this in your unique area. You're required to disclose your health condition to your employer and might be required to provide some medical documentation. So things like a letter from your doctor or data from your diary. Employers are not allowed to fire you based on a disability unless your condition meets one of two things. First, it poses a direct threat to the health or safety of yourself or others, like the police officer example, or if you're not able to perform the essential functions of the role. That's kind of a gray area, but those are the two things to kind of consider if you're in this space and you fear that you're going to lose your job because of migraine.